Yo, I need help understanding.
Hope you understand now, because they frying you, my boy. And it's well deserved. Don't be obtuse.
Hey beautiful people, how you are doing today? It's your girl Destiny here and welcome back to my channel. How you are doing? Hope you guys are doing great. So today's video is a video of a black male gynecologist who was called out on the internet. So apparently this black male gynecologist came on the internet to ask the question that why do women prefer going to female gynecologists rather than going to male gynecologists. And he went on to talk about how women would rather go for the best when it comes to them doing BBLs, getting their nails done, their hair done. Women are not being specific about if it's a male or a female person doing this for them, but just somebody that is just good at it. They just want the best. But when it comes to their hoo-ha and somebody in the gynae department, women prefer female gynecologists to male gynecologists. And this black male gynecologist choose to ask the question like, oh, why do women do that? Why do women prefer female gynecologists to male gynecologists?
I need help understanding why certain women will only go to female gynecologists, even when you need major surgery. So when you're looking for BBLs or liposuction, these same women will fly all over the country to find the best doctor with the best deals. They're looking for the best. Or if they're getting their hair done, makeup, eyelashes, you name it. It doesn't matter if it's a man, woman, whoever is the best, they are going to find them to get their hair done. It don't matter if it's a man. But if you need surgery on one of the most important things of your body and your future, it has to be a woman. That's kind of like me saying, hey, if I have an issue with my prostate, I only could go to a man because he has a penis and he has a prostate. Women don't have it. So I exclude all of the phenomenal women surgeons because I need a man. Somebody please make it make sense for me, because I'll have women that'll DM me after their surgery to ask my opinion about their surgery that they had, right? But they won't never come to me because I'm a man. So please, somebody make it make sense of why everything else doesn't matter about gender, but when it comes to surgery for your future and your body, that you are looking for the best woman possible. Not to say that there aren't some phenomenal women surgeons, but if you're looking for the best, you would just exclude it because it's a man. Drop comments down below. Help it make it make sense for me, because I'm highly confused.
Please go down in the comment section and share your thoughts. Love to know what you think about this conversation down in the comment section. Do you agree with him that a lot of women prefer female gynecologists to male gynecologists? And do you, if you're a woman or you're a man, let us know down if you prefer a female gynecologist to a male gynecologist. This got a lot of people talking on the internet. A lot of people had a lot to say about what this male black doctor said about women. In fact, a lot of women has a lot to say and share the reason why they would rather do a female gynecologist and all that. And even I was very and all that. Anyway, guys, let's go hear other people's thoughts on this issue. Then I'll come back and share my thoughts and let you guys know what I think about this and if I prefer a male gynecologist to a female gynecologist and why. So let me know yours down in the comment section.
especially when it comes to us getting the care that we need. Because if you need a black barber but don't understand why I need a female gynecologist at your big age, I ain't got nothing else for you. Yeah, we don't have to settle for men who use our very real life trauma experiences for like clickbait social media engagement.
I need help understanding why certain women will only go to female gynecologists.
My male gynecologist tore my hymen. Told me it was a completely normal experience. Before the bleeding started, he called me dramatic and said that I was being sensitive, and then proceeded to get upset with me because he somehow didn't realize I was bleeding and got blood all over the examination room. It was a fucking nightmare. The situation traumatized me so bad, it was almost 6 years before I went to the gynecologist again. My second gyno was a woman. The appointment was super brief, super painless, and I was telling her how relieved I was because my first experience was a nightmare. After telling her about it, she demanded to know that man's name and vowed to have his license revoked. She said I was the victim of medical malpractice. She said it was that bad. By the way, you being a black man who's also a gynecologist makes the creation of this video particularly egregious because J. Marion Sims, the father of gynecology, learned everything that he knew from experimenting on black women without their consent and without anesthesia. Shame on you.
I need help understanding why certain women will only go to female gynecologists.
You went through, most likely, 4 years of undergrad, 4 years of medical school, and then 4 to 5 years of residency in obstetrics and gynecology, working with women, and you don't know why women prefer women to be their obstetrician slash gynecologist. You're board certified and you're inquiring on why? I'm at like a loss for words. Even within psychiatry, a field where we are not invading a person's physical body, we are very aware of some patients' trauma history, abuse history, any history that would make them less likely to have a therapeutic relationship with a male clinician. And therefore they need to work with a female clinician. And we do our best to accommodate for that because it's for the patient. It's not about us. It's about them. Your job as a physician and a specialist in a literal organ that belongs to women isn't about you. It's not about your ego. From the very beginning, like from my medical training, I remember in our rotations, we were told outright first day that some men will not be allowed in the room during our OBGYN rotation. And it's okay. We're not blaming the patients. They're not the problem. It's okay for them to say no. I feel like your video makes people feel shame when they want a female physician, especially one who is literally touching and in contact with an organ that is super private with so many other layers of potential trauma attached to that. I would really urge you to reconsider that video and take it down because someone could easily report you for posting that, and they would have a right to.
Only go to female gynecologists.
I'm so glad that so many of my colleagues on TikTok are addressing this video because this attitude is exactly why patients prefer to go to a woman gynecologist. He keeps saying, oh, why wouldn't you prefer to go to the best gynecologist instead of just a woman gynecologist? So there's like multiple layers of misogyny in this video. One, it's questioning the patient's decisions, right? And if you're already questioning their decision to follow up with a woman gynecologist, are you gonna question their decisions in medical care too? Like, it's a well-known fact that women's pain and, women's decision to become sterile and all these things are already questioned, right? For years, while women was under anesthesia, pelvic exams were being done without prior consent. Even just besides questioning the patient's decision to pursue a woman gynecologist, he's kind of insinuating that women gynecologists aren't the best. And just because you have the best surgical skills, one, that's questionable whether or not that's actually better than a woman gynecologist, doesn't actually mean that you're going to have a better outcome. And the thing is, just all throughout the entire medical field, there's a lot of misogyny. I first experienced it in med school, and am I surprised that there are male physicians like this, even in gynecology? Not surprised. I felt it heavily in med school. I felt it heavily in residency. And I did residency in New York City, and people are like, oh, but isn't that like a very liberal area? But the issue is medicine has built-in hierarchy. And when there's a built-in hierarchy, misogyny proliferates. I just get so heated up about this because on many layers of medicine, misogyny still exists. It's really hard on med students. It's really hard on residents. It's really hard on patients. I just hope that he watches all of these stitches and learns something and apologizes, and that all the male med students, all the male residents watching these TikToks also learn something, hopefully.
I need help understanding why certain women will only go to female gynecologists.
I'm going to give you the benefit of the doubt and operate under the assumption that you're asking that question out of good faith because you genuinely want to learn. Because a lot of people are calling that video out and that question as just thinly veiled misogyny against female patients and the female surgeons that they choose. There's a lot of reasons why female patients may only want their gynecologic care and gynecologic surgery performed by a female gynecologist. Maybe for cultural or religious reasons, they would never want to be medically examined by a man unless it's a life or death situation. Maybe they've been assaulted by a man. Maybe they had one negative experience with a male physician and have completely written off all male physicians. Maybe they read the Wallace paper in JAMA in 2021 that showed that female patients operated on by a male surgeon as opposed to a female surgeon had a 15% increased likelihood of complications after surgery, readmission to the hospital, or death within 30 days of their surgery. Some women, when they're having gynecologic related issues, want to go to a provider that could potentially empathize with them as opposed to strictly have textbook knowledge. Or maybe some women just have no interest in having a strange man perform a pelvic exam, do an exam under anesthesia, prep and drape them, put a uterine manipulator inside of them, strictly because they're a strange man. And so if our shared goal is service to a patient, then we need to realize that we are not the main character and that operating on someone is a privilege that we should never feel entitled to no matter how good we think we are. Good surgeons, high volume surgeons, minimally invasive surgeons in a big city are a dime a dozen. And so when people are choosing the best doctor for them, the best surgeon for them, they may take into account what school you went to, what your gender is, what your racial background is. We would never ask this question if a pregnant Black woman said that she preferred to be taken care of by a female physician of color as opposed to a non-person of color. Hope that answered your question.
I need help understanding why certain women will only go to female gynecologists.
As somebody who's decided to see only women gynecologists, I would hope, and even beyond my personal preference, I would hope that as a man in this particular field, you would understand that some people will have some trauma surrounding the body parts that you would be examining. I would hope that your main concern and your priority would be that your patients feel safe and comfortable, and if they don't, that you would have referrals available. I would hope that you would not take this question to social media in the way that you did, asking this question as though it's an offense to you and comparing it to other surgeries where people don't care about who they're choosing or that they want to just go for the best. I would hope that instead, if you have somebody that has expressed concern, that you would ask them why and listen to them and listen to their concerns. There are certain professions that you can be the very best in, but if that profession comes with things that are related to trauma to somebody else, understand that no matter how skilled you are, that does not make you the best. It oftentimes takes listening to the person that you're trying to help.
I need help understanding why certain women will only go to female gynecologists.
The one time I saw a male gynecologist was because I was experiencing pain during sex after my IUD insertion, and he told me to not say anything when I was experiencing pain because you don't know how your partner will respond. You know, it felt pretty urgent to see somebody because I was experiencing pain. And when they told me, oh, this is the only one in the office, I thought, what's the worst that could happen? I mean, it can't be that bad. And as I was receiving my care and we were talking and he was asking me questions and I was asking questions, he was answering them, we got to the conversation about what to do when you're experiencing pain. And when he started the conversation of, well, when you're experiencing pain, I interrupted because obviously I thought he was going to say, oh, just stop. No, that's when he went, no, just gesture and all, just He proceeded to continue what he was going to say, and then I said again, oh, just tell them I have pain because I just got an IUD. And then he said, no, don't say anything. Because positive reinforcement works just as fine. So just be really enthusiastic and vocal in the moments when it does feel good. But if you tell them that it doesn't feel good and that it hurts, you don't know how that's going to affect them. That's why I ain't going to see a motherfucking male gynecologist ever the fuck again.
Yo, I need help understanding why certain women will only go to female gynecologists.
This is such a disingenuous question that it really is doing my head in, but it's also indicative of a trend that we're seeing on various social media platforms in which cis hetero men across racial and ethnic demographics are asking these types of quote unquote reflective questions to women identified folks in order to skirt the responsibility of you taking a self-reflective stance and asking yourself why women don't want to come to you, or folks like you who literally think that it is all about so-called expertise when you're actually providing care. But nothing about this video was caring. It was arrogance mixed with patriarchy in which everything was about you and nothing about your patients. So as a woman, a black woman who lives in Chicago, I would never recommend somebody going to you because you don't actually see our humanity. You just see us as parts and bits that you can fucking slay.
I need help understanding why certain women will only go to female gynecologists.
Because why would a man be there? Why would a man be there? Why would a male gynecologist ever be a thing? Why?
I need help understanding why certain women will only go to female gynecologists.
February 2006, after giving birth to my son, I wanted some birth control, permanent birth control, and I opted for a tubal ligation or getting my tubes tied. Well, my doctor, male gynecologist, talked me into something different. He said it was the best thing next to sliced bread. It was called Eshore. And he said, oh, it's titanium and it goes in a fallopian tube, and you know it's not gonna have any you're not gonna have any cuts or anything like that. And he just spoke so highly of it. And I listened to my gynecologist and opted for that procedure instead. Well, following the procedure, I was having a lot of abdominal pain. And then I noticed my periods were getting heavier and heavier. And I talked to my gynecologist, which was a male, and he said, oh, it's just, it'll pass. It's part of it's just a mild side effect, but it'll pass. And I was like, okay. Well, it didn't pass. And years went by, and I kept going to different doctors. I was in excruciating pain to the point where I ended up in the emergency room, and there was a male gynecologist, and I told him my situation, how I was bleeding heavy, how I was in excruciating pain, and I told him the procedure I had back in 2006. Now this was spring of 2017. You know what this doctor told me? He said, well, did you ever get pregnant after getting the procedure? I said, no. His reply was, well, the procedure worked. You're just having period cramps, and sent me home. Every male doctor I went to complaining about the pain and the discomfort and the heavy bleeding blew me off like it was nothing. And in 2018, I finally decided to get a female gynecologist, and I told her my plight. I told her how many different gynecologists I've been to, and I told her this the procedure I had back in 2006. I told her the excruciating pain, the heavy bleeding, everything. I told her everything. And then before I even told her the name of the procedure, she said, you have Eshore, don't you? And I was like, yes. And she said, we're going to have to get you prepped for surgery. December of 2018, I got a hysterectomy. And I was part of a class action lawsuit against Bayer. And I will never go to a male gynecologist again because they didn't listen to me.
Women will only go to female gynecologists, even when you need major surgery.
Okay, so this made me really annoyed, and I'm going to try really hard to not be spicy and assume that you are asking these questions in good faith. So one of the common uniting experiences that all women have is that our accomplishments and abilities are diminished by men. And a lot of the things you say in this video do just that. So there's two things you say at the beginning of the video that indicates that you just think women are stupid. First of all, that we're just dumb and we choose doctors purely based off of their gender. And secondly, that we make good decisions in your mind when we're doing cosmetic things because, you know, of course, we care more about cosmetics than our health, but don't make those same good decisions. That doesn't translate through to when we're choosing healthcare providers. Both of those things, I'm sorry, are very insulting to women. The next thing is, like, listen to your verbiage in the clip that I stitched. So you say basically women are choosing doctors for all these things, but surgery? But surgery what? Big bad problems can't be managed properly by women? Because that's the implication in what you said. That is so insulting to me as a female surgeon. You also seem to indicate at the end that women are not choosing the best, that they're foregoing the best to choose a female physician. Why can't the female physician be the best? You just assume they're not. So I have so many questions about how you have come to these conclusions, that these women are not choosing the best and that female physicians can't be the best. You say, well, there's certainly some great female physicians, but, which is always how these conversations go. So the reality is there's been multiple studies in multiple specialties that have compared the care of men versus women physicians. And all of them have shown superior outcomes when women physicians are caring for patients. And there was even a study that showed the effect was even more pronounced in the field of surgery when women physicians are caring for female patients. So I think a better question you could have asked to your followers would be, hey, women who are choosing to have a female OBGYN, what can I do as a male OBGYN to make you feel comfortable in my care? What shortcomings do you find with male physicians that I can work on to have a better relationship with my patients? I think that is a much better question to ask. So yeah, I really hope that you have tremendous respect for the women you care for. You do not, in fact, think they are stupid, and you think your female colleagues are equivalent to you. And if you did not mean for this to come off the way that it did to myself and others, as I'm sure you've seen, I would hope that you're more careful with your phrasing in the future, because like I said, this is a common experience women have, and it just sucks.
I need help understanding why certain women will only go to female gynecologists.
For the exact same reason why men are not wanted to work in morgues. Look it up.
I need help understanding why certain women will only go to female gynecologists.
No, you don't. You don't need help answering this question because you already know. You are a whole doctor, a full doctor. You're not a half doctor, you a whole doctor. And then specialize in gynecology. As a man, you know this from day one. You skipped the classes that they talked about culturally competent care. Were you out sick on the days that they talked about different races and cultures of people and how some women don't want you to take care of them because you're a man? That's their culture. We're not questioning why. But you bringing up BBLs and surgery lets me know that you're not talking about those group of women who it's their culture not to have other men touch. You're talking about black women, of course. And I every time I think we make some progress, there comes Yahoo's like, you wasn't asking this question, Ernest, like, be fuck for real. And BBLs is the butt, not the vajayjay. What are you talking about? You know what? I'm so sick.
I need help understanding why certain women will only go to female gynecologists.
So in that best provider, I see that you're crediting yourself as the best possible option. But you're ignoring a couple of things about your profession. And I don't know if that is deliberate or you are actually ignorant of the stats, right? Because whether we're talking about Tyndale or Heaps or Burke or a dozen other cases, whether it is New York or California or Utah or Texas or here in Illinois, statistically, women are finding it to be safer to see providers who are also women. Not because they are just ignoring credentials. I can find a highly credentialed provider of absolutely anything in Illinois. Illinois has something like 20 of the best hospitals in the country, right? Whether I am in Central Illinois and going to Carl, I am in Chicago and going to Northwestern, UIC, or any one of a dozen other hospitals in the Chicago area, I can find a highly skilled woman who is a provider without me having to worry about her sexually assaulting me while I am unconscious, or in the case of some male providers, while they're conscious, right? So let's be clear here. They are seeking the best for their situation, for their comfort level, for their needs. And you may say that you are the best, and I have not seen your stats, but I know that you are in a market where there are plenty of highly qualified doctors, and I don't have to worry about seeing someone who is not going to pay attention to the data in his own field about sexual assault and provide culturally competent, comforting care. Just saying.
I need help understanding why certain women will only go to female gynecologists.
Because we feel like it. The reason is none of your business. We go because that's what we want.
Period. Period. She said it. Anyway, guys, let me know your thoughts about this video down in the comment section. I'd love to know what you think about this conversation. So feel free to share your opinion. But please, please keep it respectful. You don't have to disrespect anybody for you to air your opinion. So go down in the comment section and share your thoughts. And let us know if you prefer a female gynecologist to a male gynecologist and why you prefer that. Go ahead down in the comment section and share your thoughts. But like I said, keep it respectful, okay? All right. So first, I just want to say, like, for me personally, I think I've only seen a female gynecologist once, but all my gynecologists I've seen growing up, even as a child, as a teenager, has always been a male gynecologist. And this is why I would say my first male gynecologist that I ever saw, that ever examined my hoo-ha, was when I was 16. And I would say that doctor really made me feel very comfortable, and I was seeing that doctor for a long while. But when I moved a city and being married, and then because after that doctor, I didn't really see any gynecologist until I was married, and then trying to TTC and all that. And there was this doctor, amazing doctor. I think because of my first experience of male gynecologist, my first ever experience with a gynecologist, I think that just already prepped my mind with how to be like. I was very relaxed, but also I was also very uncomfortable for a male to. So I remember my first appointment was very awkward, but he really made me like feel very comfortable. Like, he was explaining everything. Even before he would touch me, he would tell me, I'm going to touch this, you're going to feel this. And I just felt, and I feel like here in Nigeria we have more male gynecologists than female gynecologists. But in the case of this conversation, I would say why women will prefer, and I don't understand why a gynecologist will come and speak on this, a male gynecologist will come and speak on this, because the stat is there, like the sister said. The stat is there. So why are you asking something that you know that a lot of women have been SA in the process of being examined, and it's actually awkward for an opposite sex to be touching you in your hoo-ha. Like, so why would you just consider more of, okay, what makes this patient feel comfortable? He's asking the question, is the person's health, and the person feels more comfortable. Because when it comes to your gynae and your OBGYN issues, you want somebody that you're going to feel comfortable with, somebody that you can be honest with, somebody that is not going to judge you, somebody that is not going to question what you're telling them or how you feel. And I can really also relate to that part where they say, the women were talking about how women pain in terms of they are being downplayed by men because they don't even understand. I don't know if you guys have seen this experiment that has been going on social media of men using this period cramp stimulation thing. A lot of men can't fathom how this is. Yes, they may have the textbook, they may know the textbook. A lot of doctors may have the textbook format of it on what's going on, but they've really not experienced it. So I get it why a lot of women will feel more comfortable with a woman that can relate, that can empathize with their pain and understand their pain more than just a textbook. So for this man to come to kind of question it, like, oh, why are women? I just feel like it's very, very insensitive, and I feel like it's coming from a place. I don't even understand. This is somebody that went to study gynecologist. So for him to answer that question like somebody that does not know anything about a woman and the old trauma thing, like, I just feel like, then why did you, like, I just feel like he's not trying to be very understanding and empathetic towards women and our issues and our struggle. So why did you go, really, why did you study gynecology? Like, why? I know some people will say, oh, but men do go see gynecologists, but we noticed that the percentage of women that visit the gynecologist is higher than men. It is what it is. So why do you really study it? Because, mind you, this man's social media name was Tumor Slayer. Yeah. So I don't know his own agenda for him coming. Like, I don't get it. Why will you, when you cannot even try to connect with a woman's struggle and pain? Anyway, guys, let me know your thoughts about this conversation down in the comment section. Love to know your thoughts on this conversation. So feel free to share your opinion down in the comment section. But please keep it respectful. You don't have to disrespect anybody for you to air your opinion. Okay? And please share this video with somebody that you want to be part of the conversation, because that's what we do here. We have banging conversation. So go ahead and share this video, and please don't forget to give this video a thumbs up, smash the like button, because this helps YouTube to push out my content, and that will be you supporting your girl. With that all said, guys, don't forget to subscribe if you haven't subscribed, and I will see you guys in my next video. Deuces.